The topic of today's chapters is One Health tools and the opportunities for their rationalizations and application to country context. Within the action track 1 of the joint plan of action of the Quadripartite, which is related to enhancing One Health capacities to strengthen health system of the One Health joint plan of action, webinar is related to the One Health implementation, in particular, the development of tools on One Health. Some questions that this webinar will address are related to what are the One Health tools currently available, how they work, what are the next steps for implementation of the tools in countries, and what is the right enabling environment to implement these tools in a sustainable approach for One Health.
Opportunity for Indonesia having a pilot of tripartite joint risk assessment tool in 2018. We are facilitated by tripartite gathering multi-sectoral agency in Indonesia, in particular Ministry of Health, Ministry of Agriculture, and Ministry of Environment and Forestry. 1 year later, in 2019, we implement a real joint risk assessment during an emergency event, the incursion of rabies in Sumbawa Island, were historically free from rabies. This joint risk assessment supported by WHO and FAO, and then joint risk assessment team provide recommendation 70 dog vaccination coverage required to prevent further rabies transmissions. We need integrated bite-based management and integrated investigations, and also provide recommendation on key messages for risk communication that's relevant for local context. Following the piloting of tripartite joint risk assessment operational tools, we, as a part of One Health task force in Indonesia, with support from WHO and also FAO and OIE at that time, during November to December to 2020, during pandemic, we organized what we call familiarization training, consists of 3 batches. 75 officers participate in the training. It was a 5 days online training. First, joint risk assessment operational tools allow us to share data or information among sectors, then foster ongoing intersectoral collaborations. Using joint risk assessment operational tools also allow technical teams in each sector to understand the entire situations better, and then helping them in their own daily work and be able to advocate their senior level using their document or report. Joint assessment operational tools help us to identify missing information and gaps where capacity can be usefully built.
Thank you, dear colleagues. I'm happy to have this opportunity to meet you all and present our experience on using the multi-sectoral coordination mechanism operational tool of the tripartite, now quadripartite zoonotic. Actually, we used the previous outcomes also during our workshop on multi-sectoral coordination mechanism operational tool workshop in May this year. Two words about the tool itself. The MSMOT supports national authorities to improve coordination in managing zoonotic diseases and other threats at the human-animal environment interface by using 18 strategic technical elements to establish or strengthen a multi-sectoral One Health mechanism. This collaborative government platform allows stakeholder ministries and agencies to interact to support improved preparedness and response for One Health challenges, including zoonotic diseases. The MSMOT consists of 8 steps and based on the principles presented in the Quadripartite Zoonotic Guide, allowing countries to address leadership and technical functions to improve collaboration, communication, and coordination across the sectors to achieve better health outcomes. The 2 resources, the MSMOT and the Zoonotic Guide, were used together. First of all, we defined the role and scope of the One Health mechanism. Preliminary during pre-workshop meetings, we identified it as establishing One Health mechanism to control zoonotic diseases, ensuring cooperation between stakeholder agencies at all levels, including communication, rapid response, joint implementation of measures, and analysis of results. But during the workshop, we broaden it, indicating the antimicrobial resistance, zoonotic diseases, and biological risks of food safety. We'd remark that the collaboration includes joint actions at the animal-human environment interface for prevention of incidents, preparedness, response, and recovery. From 18 elements, we finalized the list of prioritized elements, which are membership, leadership and governance, policies, legal frameworks, resources and funding, need for One Health and zoonotic diseases prioritization, coordinating joint risk assessment, joint activities, communication, and coordinating investigation and response. For each of elements, the gaps were discussed, actions, goals, and outputs and the level were indicated. Activities to address these gaps were matched and identified: impact, high, medium, or low. The feasibility of the action, very feasible, somewhat or difficult. Who will lead the action, the role and responsibility of each partner, point of contact, even name, title, organization, sector of each partner, priority of the action and timeline, resources needed for each partner to conduct this activity, and indicator for the activity to be sure and able to measure the performance of it. Guided by the questions in the selected element worksheets, we filled in the action planning table. After all, action plan was finalized, and we included our findings and elaborated it as a government decision as required by our legislation for intersectoral legal act. The draft action plan is now circulating for the official feedback for the agencies.
I'm going to very briefly introduce the environment sector stakeholder mapping needs assessment tool, and then I'm going to hand over to Dr. Ishmak to talk about the Bangladesh experience. Such a training program has been developed by FAO with a number of partners globally and in the Asia Pacific region. This program is called the Field Training Program for Wildlife, Environment, Biodiversity, Ecosystems, and is referred to as FTP-WEBI. This training program is targeting the in-service professionals from the environment sector ministries and is the complement to the existing programs for public health and animal health. The objective of the program is to strengthen the wildlife and environment sector ministries' capacity to participate in One Health as equal partners within the country. To be able to provide these environment sector professionals with the training they need, we must first identify what is their current capacity to contribute to One Health and their specific strengths and gaps, which we assess through FAO's environment sector stakeholder mapping and needs assessment tool. The results of the tool allow us to provide country-adapted training. I'll note here that in addition to the training needs assessment, the tool can also be used to assess the capacity of the environment sector more broadly and can complement other One Health assessments where the environment sector is less specifically included. To date, we've piloted this tool in Bangladesh, Thailand, and Indonesia, and we've tested it in Laos and Mongolia, and we have plans to further roll it out in the region in 2023.
Happy to share some of the experiences from Bangladesh, as Carla mentioned. This is environmental sector service, stakeholder mapping, and need assessment exercise, particularly for developing the curricula features. We had a very encouraging participation in the workshop. The exercise has identified that there are some good governance and systems in some areas, but some technical support will help increase the sector's ability to contribute to One Health. Environment sector partially contribute to One Health sector, but needs enhanced engagement through participation, implementation of One Health program, government commitment, dedicated resources and training. Last but not least, environment and wildlife in service professionals would benefit from the FTP WAB training programs.
Thank you very much, Polio, and good afternoon, colleagues. As introduced earlier by Polio, we are fortunate today to have three eminent panelists. Each of them, from a different perspective, will be sharing their thoughts, their analysis, and their recommendation about how we could best implement One Health using the tools as an entry point here. Given the range of tools we referred to earlier and their utility, how can we, in your view, how can we best balance the desire for standardized tools with the need for the users to have a role, to have the possibility to select and adapt tools to their needs? In your view, how would you share any thought on also the type of tools that can help us measure progress of the One Health Joint Plan of Action?
Thank you, Baba. So every country and region is different, and there's not a single cookie cutter approach that can work for a One Health tool, let alone a suite of One Health tools and linking those together. So one thing that is available is a theory of change, which was developed by the One Health High-Level Expert Panel, or OLEP. And while that was designed to help guide OLEP's own work and that of the Quadripartite, it does provide a conceptual framework for other organizations, agencies, and initiatives working towards similar One Health goals. And of course, it's aligned with the recently released One Health Joint Plan of Action as well. And so looking at those can help countries or regions think through a pathway of where they might want to start with One Health tools. By having those One Health tools, it can help bring people into the room together using a transparent process with equal input from everyone and making those shared priorities. And doing that can also help to enhance trusted networks across sectors and build collaboration. So One Health tools are great and important. So just to emphasize 2 points, again, to ensure optimal outcomes for the countries or regions using One Health tools, those partners responsible for implementation need to regularly collaborate and share information in a timely way so the outcomes of one process can help inform the next and give the maximum impact to users. And then we also know there are still gaps and additional One Health tools are needed. And when those One Health tools are being developed, they should not be done in new silos, but really created with all the partners engaged so they'll be most effective for the users. And those are both really important features in continuing to produce and implement strong One Health tools that can help us make a difference in improving health for people, animals, plants, and the ecosystems and environment we all live in.
I think it's about two things I want to emphasize here. I mean, first of all, I think, yes, tools are helpful, and yes, legislation is the basis for a lot of our actions. But ultimately, it's a lot about people and how to bring them to the table. It has been said earlier, how to motivate them. I think it's about each and every one now in this webinar. It's about all of us and how we are bringing One Health forward in our own work and responsibilities and in our contexts. Also, of course, the tools like, for example, the stakeholder mapping can be very useful here, because sometimes you don't even know who is in charge in a different sector, and this is true for all countries, also ours. And we have here in Switzerland, we have engaged in a couple of One Health activities, and they have exactly these characteristics. It depends on individuals. Sometimes you have a change in the management, and suddenly things move, and before they didn't, and your legislation is still the same. So that's one thing. And then maybe my second point is then, yeah, unfortunately, crisis helps. Crisis like the pandemic, where it becomes critical to work across sectors, because we all facing the challenges. And these may be very technical, but they can also be just lack of workforce. It's also an opportunity for One Health. So, I mean, if not now, then when are we moving this forward to and bring it into action?
Let me move to again to Nicola. From your perspective, from a perspective of a development partner, how do you see One Health implementation linked to the discussions on the pandemic treaty for prevention, preparedness, and response to future pandemic? How, in your view, can One Health be presented as a development issues and yet understood as necessary for preparedness and response to emergencies? And just if you could end up just sharing your view on what would be your expectation from One Health implementation at regional and country level, and what role do you see for the quadripartite?
We know that One Health is not just about preventing epidemics and pandemics, and it absolutely does have to be seen as a development approach to multiple development issues. And unfortunately, I think we do see a reductionist approach from many partners that would prefer to see it just as being about preventing zoonotic disease. And I can completely understand the tendency, but it is unfortunately, again, not doing justice to what we've learned so far about how the planet works. That we, as Katarina says, all of us in this webinar, in our fields of work, have a responsibility to keep reminding people about the bigger picture, preferably with concrete examples that we've brought with us from country level, or even better, lower levels, so that we can demonstrate whether it's about neglected tropical diseases, whether it's about the impacts of climate change on health, whether it's about foodborne disease, that One Health is something that we need to work into multiple domains. So what I hope we expect is realism and pragmatism. We have to remain focused on the needs at hand and not get carried away with great theoretical responses. And I think the quadripartite has a critical role here at all levels to walk the talk, to demonstrate what global coherence and cross-sectoral coherence really looks like at all levels. And they in turn also have the responsibility to keep listening to what's missing, to what's needed at those national and subnational levels, and keep playing that back in their joint work. And we as development partners obviously have the responsibility to help. So I hope that addresses the various questions. Thanks very much.